right? So these are things that, as nurses, and I'll tell you, if you've ever heard of Barack Obama, who's the president of the U.S., and you may know that we have what is called healthcare reform in the U.S., and we will be increasing the amount of people with healthcare insurance by about 40 million more people.
那个现在奥巴马总统新的那个医疗照护改革，会增加750万的人的那个有医疗的照护保险。
So one of the plans is for nurses in particular to open up nursing clinics, and so anything I talked about in pre-hypertensive state, right, and prevention, now, or I should say now, in a couple of years when we have the finances to create nurse-run clinics in the U.S., that prevention will become more critical so that we want to keep the patients pre-hypertensive rather than hypertensive, and there will be money in the government system for nurses to do that type of educating for the patients.
所以奥巴马新的那个医疗照顾计划，其实就是让护理人员来开护理诊。那这个护理诊主要的这个对象，其实对于这个高血压前期的个案的这个卫教的工作，可能就会变得很重要。
And the other part of that, which I think is just wonderful, is that if we have what we call the U.S. nurse practitioners, so these are nurses who have their undergraduate degree in nursing, but then they have a master's degree in nursing, and they're now what we define in the U.S. as nurse practitioners. So they assess patients, they diagnose patients, and they treat patients. So what is happening in healthcare reform is that now we're saying that whether you see a physician, doctor, or you see the nurse practitioner will make just as much as the physician to see that patient to do the pre-hypertensive education and lifestyle changing, which is very exciting for me as a nurse practitioner, not as good for the physicians who hate me because we're getting the same amount of money.
他说：“那个我们未来专科护理师啊，同样照顾这个高血压前期的病人，他其实得到的保险给付应该会是相同的，所以这个给会有一个很大的市场。”
Okay, so yet again, you've seen this before, that optimal blood pressure is less than 120 for systolic and less than 80 for diastolic is normal, okay? Pre-hypertension, which is where, like I said, nursing is intervening, and we will have reimbursement to this teaching for the first time, is that pre-hypertensive state. Hypertension is greater than 140 over 90, but remember, I said, if you are 65 years of age and older, 140 over 90 is normative. For the elderly, is 160 over 90 is then pre-hypertensive. Okay.
现在的那个第7版跟第6版不一样的地方，就是他们把那个高血压前期独立出来了哈。那高血压前期就是低于这个140 over 90以下，那他又在强调，其实对于老人是160 over 90。
And remember one more time that if you have pre-hypertensive or hypertensive, the first thing you're going to think about is what? Behavioral changes. What can we do? Diet, exercise, change how much you're drinking, or reduce how much you're drinking or consuming of alcohol, unless it's 2 glasses of red wine for a male, 1 glass of red wine for a female is not the white wine, or sake, no, red wine, no sake, yeah, exactly, okay. If you have stage 1 hypertension, and this is what's new in the JNC7, is that we give you lifestyle changes, and then you as a nurse practitioner or doctor says 1 medication, okay? Usually it's the thiazides, the diuretics. If you have stage 2 hypertension, which is from 160 and above for adults, remember that, 161 would be older adults, okay? You then start lifestyle changes, reduce the weight, physical activity, reduce what you're eating, all the fat and the sodium, but then we're going to have 2 drugs on for you, okay? That is now the national standard that we do as nurses or physicians in the U.S. Clear?
好 ，yes， 他其实就是 再重复而已啦。大家需要再翻译吗？不用，好。
Okay, good. All right, let's hold on. Let me keep on going here. All right, so the goal is to get to the goal, which is, of course, to reduce the high blood pressure, because high blood pressure also has effects on both if the patient is diabetic or has renal disease.
所以这个所谓的目标值就是这样。
Great. So one more time, I'm going to go through this now rather quickly because I'm sensitive to the time here. So lifestyle changes we know for prevention. Drugs we'll talk about a lot in the next 20 minutes. What do we do when a patient is still not at the goal, which is to keep them below the hypertensive level, and follow up and monitoring? All right. So here we go. We have lifestyle changes. We have lifestyle modifications now because the patient has hypertension. Remember, before we talked all about pre-hypertensive state. Now, this next section is all about you have diagnosed them with hypertension. You take 2 readings, at least 2 readings, to show that the patient has hypertension.